Adamawa State Government, through the State Ministry of Health and Primary Healthcare Development Agency, with funding support by Save 1 Million Lives, seek to strengthen access to family planning with the aim at addressing the high level of maternal and child morbidity rate in the state, the poor quality of health of Nigerians due to poor healthcare infrastructure, inadequate human resource for health, and inadequate availability of contraceptive and other life-saving reproductive health commodity leads to this unacceptable situation.
Okay, indeed, these are in line with the policy direction of the leadership of His Excellency Right Honorable Adamawa. He has given us a marching order that we should revamp the primary healthcare delivery system and improve its efficiency and its services rendered to the people of Adamawa State. In this regard, the leadership of the Primary Healthcare Development Agency deemed it fit. Remember when we celebrated the World Population Day, we underscored the importance of improving access to service. And one of the key things that we are underscoring is the issue of family planning, which entails empowering the people on how to space, how to have healthy children, how to have productive and get the demographic dividend out of it. And that is what we just did today and we will do for the next 5 days for this currently batch. We are training 100 people from the 21 LGA. That will give us a reasonable spread that will reach over 100 primary healthcare facilities.
However, this perhaps among other outstanding issues prompted the need for the 3 weeks training of over 100 healthcare workers across the 21 local government of Adamawa State on family planning methods and other requisite knowledge.
First of all, I want you to note that family planning or use of modern contraceptives is one of the indicators of Saving 1 Million Lives program for results. It is an indicator that has suffered setback in the previous years in Adamawa State. But the outcome of the 2019 SMART survey reveals that Adamawa State has slightly improved to 32%, and 32% is still unacceptable, is still below expectation. And we were meant to understand that there is inadequate human resources or inadequate health workers to be able to do family planning in the health facilities, particularly the use of insertions and other methods, which is the most acceptable method in Adamawa State. So this training is planned to increase the number of people who can be able to do insertions, and that is the long-active and reversible contraceptives. So we believe that at the end of this training, majority of our facilities will have competent workers that will be able to do insertions, and in the long run, it will go a long way in improving the indicator of use of modern contraceptives.
The need to address limited financial and physical access to high-quality health services and commodity, low level of awareness about various health services, and the high prevalence of other diseases cannot be overemphasized. Hence, the need to strengthen ultimate goals in developing and implementing policies, programs, and strategic planning to facilitate a continuous improvement in health status and quality of lives in Adamawa State.
It's an important training because with family planning, normally reduce maternal mortality. When we are assessing family planning, the death of a woman and children will be reduced at least by 30%. That is very important for us to have this training, so that since family planning is being accepted, but mostly by the women, so and the death of the woman is frequenting. So with the assessing of this family planning, there will be a reduction on maternal mortality.
In view of the foregoing, Adamawa State Government, under the leadership of His Excellency Right Honorable Amodu Umaru Fintri, took an urgent step towards creating the required favorable and conducive environment for the delivery of access to high-quality health services by people of the state in their different localities.
Then, family planning, what we normally do, we don't call it now family planning, we say child spacing. What we are trying to do, we are trying to prevent too many pregnancy, too early, too risky, and too late. And the important, that's the benefit. That's what we are trying to prevent. the risky pregnancy. What I mean by risky pregnancy, we are talking of in anemia. There's eclampsia, maybe you will not know it. Eclampsia. We try to prevent it. That is the risky pregnancy. Too early, that is less than 18 years. Too late, above 35 years. Too many, we try to space them. That's what we mean, how to prevent it. Then the benefit, with benefit of family planning in the society, that will increase our education sector will be good. It will take off. Our agriculture, we can be able to feed ourselves. Our children can go to school. They can, they will be lively. And even the man and his wife and his children, they will be lively in the house because he can be able to feed her, he can be able to send his children to school. That's the benefit of family planning. And the woman will have rest. When she's spacing, she will be having rest, and this is the system, our system in the body. That's at least after 2 or 3 years, it normally comes back to non-pragmatic pregnancy, because when you're frequently taking of the pregnancy, you see how malnourished the woman is, and you see how malnourished the children will be. So, assessing family planning is very, very important to the man and the woman and the society at large.
Some of these steps include building the capacity of 100 community health extension workers, CHEWs, in line with the policy on free contraceptive and life-saving maternal reproductive health commodity, accelerated implementation of activities around the long-acting reversible contraceptive lag methods, tax shifting with appropriate supervision of the community health extension workers, creation of budget line, and increased funding for key activities such as the procurement and distribution of required reproductive health commodity, as well as an increase in collaboration with the private health sector in healthcare service delivery, among other interventions.
I'm so excited with this training. I learned how to incite implanon, JEDEL, and IUCD, intrauterine device. With this, my capacity is being built. If I go back to my community, I will make sure I render quality services to them in the community.
And we are here for the training on family planning, which we have been trained well on so many different types of family planning, which are IUDs, implants, implanon, and the rest of them. And we are well appreciated because our facilitators did well, and they make us to understand so many things about them. And they even taught us practically we can be able to perform it well